The heart is a rhythm found not just in our bodies, but in our everyday lives. We, the people of the Caribbean, are the heart of these great island nations. Together, we are the lifeblood that forms the architecture of society and greater civilization. Health and home are intrinsically linked in today's modern world. Each day is a new and glorious opportunity for our personal development, self-transformation, and growth. In today's program, we will have an insider's look into the diverse perspectives of not just the medical sector, but of the people of Grenada, the Caribbean, and beyond. I am Dr. Mariam Abdul-Richards, and you're looking at Caribbean Medical TV.
I sometimes say that more information is given out is the more people don't hear. Early detection saves lives. So someone that may have started having some abdominal symptoms, some changes in the stool, some bloating, some gas feeling, as we like to say, advise you that you go see a doctor, especially if you have a family history. We need to take a grip of our lifestyle, hold for a minute and see what am I doing right, what am I doing wrong, and see how much changes we can do. Changes of lifestyle is going to make a difference. This will help us to have a better person, then it's going to spread to a better family, then it's going to spread on to a better community, then it's going to spread to a better country, and it's going to be a better world.
The thing about prevention is that the burden of prevention still rests on the patient. So we are hoping that with programs like yours, in which you educate the public about the risk factors for disease, then they take it on, because the doctor cannot get up and go and exercise with you. The doctor cannot stop you from smoking. The doctor cannot extract your sweet tooth. All of these are things, the burden of which rests solely on the patient. And they've got to make the time to do that, to keep themselves healthy.
Non-communicable diseases is a big problem in today's society, and is basically becoming an epidemic. A lot of the ways in which we can prevent these things would include lifestyle changes, and it has a lot to do with starting these changes and implementing them from childhood so that these changes can go and become their habits into adulthood. We're talking about things like dietary measures as well as increased activity such as exercise to prevent the occurrence of these things like hypertension and diabetes, obesity, etc.
Stress management is really important. You want to get those cortisol levels as low as possible. You have to prioritize sleep. That is your most precious commodity, so prioritizing sleep. Stepping away from alcohol is another one. I know in the Caribbean we have a very active social life, and it's not an easy step to achieve. After the age of 40, every year we lose more and more muscle. As we age, we need to eat more protein, not less. So in order to maintain that muscle mass, in order to make sure that your bones are actually not fragile and don't end up in an emergency room, you need to make sure that you eat enough protein. You need to make sure that you eat lots of vegetables, fruits, keep yourself hydrated. Those are the basics.
There is a player in the room that sits quietly, and they need to come in to the limelight, and that's the nutritionist. I find that patients don't take it seriously enough when you refer them. No patient should be admitted to Port of Spain General Hospital, West Shore, Queen Elizabeth Hospital, University Hospital in Jamaica, and be discharged without a referral visit to the nutritionist. Because we keep saying diet, but you're discharged from Dr. Massey's office, and all he could probably give you is a sheet written by someone in North America who is going to tell you about kiwi fruit and not going to tell you about what's available in the Caribbean.
I think nutrition is an integral part of managing many of the diseases that we see manifesting here in our region, in the Caribbean. We have to eat
healthy every day. Now, I'm not saying that once in a while we wouldn't go, but that has to be the exception rather than the rule. Our problem in the region is that we're making the exception the rule and we're making the rule the exception. If we don't make food our medicine, medicine will eventually become our food.
In Guyana and the wider Caribbean, and I would suspect in much of the Western world, the prevalence of chronic non-communicable diseases is increasing. And more we're having patients with multiple diseases at once. So patients who are diabetic, but they're also hypertensive, and they may also be suffering from dyslipidemia or high cholesterol, or they also have issues with protein in their urine, so they have kidney disease and so on. So multiple diseases in one patient, it's very common.
We now have to advocate for well checks or well visits. And nobody's asking you to go to the doctor every month or every 2 months or every 3 months. If you're perfectly fine with no significant family history, then really and truly you might go every 3 years and that might be adequate for you. But if you have risk factors for chronic illnesses, mother, father, diabetic, you're obese, then you should be having yourself checked probably on an annual basis.
As a Caribbean region, we grew up with folklore. A lot of our old persons, they had a lot of things to say with particular types of foods. They're now starting to understand the importance of why is it we need to stay healthy and be healthy, and especially with persons with chronic diseases. And yes, it is important for us to be a part of that integrated team, because at the end of the day, when it comes to healthcare, we have to be integrated in how we manage these persons. A doctor can prescribe medication, but that person can go home and take medication, and then they still go and drink the alcohol. They still go eat the fatty foods, the salty foods. So while they think that it's okay, I'll take my medication, I'll be fine, we do have to integrate nutrition to be a part of it.
So let's focus on juices. What are you gonna wash down the meal with, right? As Trinis like to say, I have to wash it down with something, right? This is one of the worst things you can do for your blood sugar especially. So when you drink sugar, it's very different from when you eat something that's sweet. It's because in drinking it, your body doesn't have to digest. It goes straight into your mouth, into your bloodstream. And so the fastest way to spike your blood sugar is by drinking sugar-sweetened beverages. So that includes your juice, your Morbi, your energy drinks, for those of you who like your malted beverages. So all of those would be covered in sugar-sweetened beverages. And people often think, okay, well, I don't drink soda, I drink fruit juice, so it's better. Usually they have about the same amount of sugar if you take the time to look at the nutrition facts. So when it comes to drinking sugar, not a good idea for really anyone.
There was a time when the people of the Caribbean, you ate what you produced. You lived off the land, we walked from place to place. Now, we drive from place to place. We breathe in the carbon monoxide from exhaust fumes as we are stuck in traffic. And we're consumed with jobs that are short on manpower, so we have to work longer hours. And so what happens? You grab a quick bite, fast food. And if you were to even look around the Caribbean, there is a significant growth in the fast food industry.
One of the things that is most important is restricting salt, which I know is a very hard thing for us Caribbean people because we like to taste our salt. But restricting salt is very important because salt contributes a lot to high blood pressure, which causes kidney damage. So the salt restriction is very important. Also, drinking enough water.
We always advise our patients to use less processed foods. Anything that is in a can, anything that is too salty, anything that is too spicy, we always advise that you use less of it. A lot of patients would complain of the burning sensation or the upset feeling sensation in their stomach. So we always advise the patients to use a less spicy diet, less fried foods, and less fatty foods as well.
I do appreciate the fact that persons are being more aware of their nutrition and how to eat healthy and lead a healthier lifestyle, because at the end of the day, we do have to try and do our best to keep our nation healthy, the region healthy. We're trying to focus on reading food labels, because reading food labels, it's also another important factor in making sure that we as persons choose healthier food options. We always go through the food label, and when we reach to added sugars, I always ask them to look at the number that is on the label. And then I would ask them, do you have a calculator on your phone? Pull that out. And I would let them do simple mathematics. And I would tell them, you divide that number by 4. And when they divide the number, they would tell me what they got. And I said, let me ask a very simple question. Will you at home take a standard glass with water, plain water, and would you take 90 spoons of sugar to that glass, and would you drink it? And they would look at me like, no. I said, but that's exactly what you're doing with these types of products. So now we have to try to educate the public that even though these foods are available to us and to you, what is the best product to choose?
Be sure to subscribe to our channel for early access to our episodes. Stay tuned and we'll be back with more.
I can see clearly now the rain is
At Guardian Group, we've seen so many of our customers achieve great things. From key moments when together we've planned for the future to those unforgettable days when you've celebrated the rewards of those great decisions. So, it's no surprise that after 175 years, our optimism is stronger than ever. Because when you've partnered with people to achieve their best lives as long as we have, you tend to see the world a little brighter every day. Guardian Group. Live easy.
Welcome to You in the Caribbean and Beyond. I am Dr. Mariam Abdul-Richards, coming to you from the beautiful Spice Island of Grenada. And this is Caribbean Medical TV.
As we've seen, healthy eating patterns can make a significant impact in our region. Nutrition is a key element in our foundational development. Over time, we've witnessed the emergence of other chronic diseases due to various factors. Let's head over to Jamaica to hear more from Professor Boyne.
For me, here in Jamaica, my stomping grounds, diabetes is probably the most common endocrine disorder that we see. We may also see another disease, but people don't think of it traditionally as an endocrine disease, but obesity. Obesity, which affects 2/3 of Jamaican women and about 40% of Jamaican men, is also regarded somewhat as an endocrine disorder.
Now, when renal diet comes into play, and even with the diabetes, I usually tell my patients with diabetes, once diabetes come in, you have to start watching sodium, you have to start watching your cholesterol. Because a person with, in my 30 years of practice, I can see a person with hypertension who never develops diabetes, never develops high cholesterol. But on the reverse, a person with diabetes, more than likely, there's a higher risk of developing hypertension and developing high cholesterol levels. So once a person comes with diabetes, you start addressing those issues. You don't wait for it to come into play in order to address it. And that's the proactive, the preventive way of handling such diseases.
I like to say in the Caribbean, we have some of the best fruit in the world. Yes, and of course, we love our fruits. But now that we are sedentary, we are driving to work, we are sitting in the office all day to work, and our activity levels has gone down. This is why it's become more of a problem now when we overindulge in the fruit, because we take that sugar in and we are not burning it off, so it stays in your bloodstream and causes problems, right? Raises your blood sugar. You may not feel it. People say, well, I feel good, I don't feel any different. You may not be able to tell when your blood sugar is high, but you will over time develop the symptoms.
For the person with diabetes, you really want to make sure that you're controlling portions. You want to make sure you're controlling portions, and you want to make sure that you're eating foods that are fiber rich, because fiber takes a longer time for the body to process, which means you will more than likely have a slower rise of your blood sugar. So we tell people use wheat as opposed to white when they have diabetes. And it's not that eating a piece of white bread will be the death of a person with diabetes. It's just that your body is going to process it a lot faster, so you will get a higher bump on the blood sugar levels. So portion control is very important, and making sure that they include a lot of the foods that have very low carbohydrate content, which are our vegetables, right? So sometimes people with diabetes tend to eat a lot of fruits, but when fruits is broken down in the body, you're going to have an effect on your blood sugar. The vegetable foods have very little, almost a third of what you would find in fruits per portion. That's the food that they need to increase, that are most diabetes friendly. Doesn't mean that they can't have a little of everything, but the vegetables should be concentrated for the diabetic patient.
The key is that how do we, slowly cut back. So if you're accustomed eating, the whole plate, I want you to start with maybe cutting it down by a quarter. So a quarter less than what you're accustomed eating, right? So if you're accustomed having the 2 full cups of rice, you cut it down to a cup and a half. And the trick of that, or beauty of that, is that those satiety centers, how full you feel, it can't really tell the difference in that small change. So imagine if you can do that, for a month, and then next month you cut back a little bit again. See how easily you can get back down to what is an appropriate portion, because you're also giving your stomach a little time to adjust. And you wouldn't believe, over time, you try to go back and eat the same amount of food that you used to eat, and you wouldn't be able to.
It is not to take anything for granted. I think part of being in the Caribbean, sometimes we may have a very laissez-faire attitude. Or, in the Caribbean, everything is just calm and cool. But as time has now changed, we are now more mindful not to take things for granted. So even something as simple as family life and spending time, we also discovered that persons may have taken a lot for granted in terms of their own health, their own self-care. And these are things that we stress more and more even now.
We have traveled across our region learning about the health of our Caribbean communities who have shared their work and their very lives with us, so we can show them to you to help raise awareness.
I'm Dr. Althea Carr-Stewart, a pulmonologist in Jamaica, and I'm just so grateful for this opportunity for this Caribbean Medical TV series to give health education to my Caribbean people, to make them understand, make them aware of the chronic diseases, and to take an interest in their health when symptoms start that they don't understand, but this will hopefully give them a better insight into what can happen and that they'll seek medical advice early.
Well, I have to say I'm really happy to be a part of this initiative because, Caribbean Medical, I have to say that having a health and wellness agenda being pushed forward is something that's needed throughout our Caribbean islands. Let us educate our population on how we prevent these illnesses. So I think this program is an excellent initiative. It's pushing forward the whole health and wellness agenda, not treatment, but wellness. And I want to encourage you to go forward and continue. And we hope that you will do another tour again and come right back to see what's new happening in Grenada.
So at this point, I believe that I have a sort of well-rounded knowledge of what I believe our Caribbean needs. And when I say it like that, I mean that integration of all our doctors getting together, that common spirit, I believe that's what we need. And I think this program is actually helping with that. So we can actually see how things are reflected. For example, I gave our side based on what I see in Grenada. You would have someone from Barbados, someone from Trinidad. That helps us to come together and to understand our common pathologies, to understand how it's done here, what we see here. And this helps to educate, right? So I see this as a program that we would need to keep pushing, because this would somehow assist all of us throughout the Caribbean and even the wider world.
I think it's very important that we establish these sort of relationships, because in a situation where you require services that is not available in your home country, the fact that you can get it in another country within the region, which makes it more comfortable for you because it feels closer to home, then that allows patients an opportunity to save their lives, basically. It allows the mingling of our sisters and brothers across the Caribbean countries. And I think it helps to boost all of our economies, which is great for everyone.
And so that's why programs like Caribbean Medical are so important for the region, because we get to hear what everyone is going throughout the region. We sometimes we think that we're in it alone, but no, we're not isolated. These issues aren't unique to us alone, right? The world is a global village now. This brings good awareness and help us to learn from each other.
Throughout this program, we would have emphasized the link between mental and physical health. We all need to have a balance between our physical health, our mental health, our spiritual health, and of course, our heart health. We in the Caribbean are blessed because on our doorsteps, we have some of the best beaches in our midst. So anytime you feel stressed, anytime you feel that maybe you're balancing just too many things at one given time, just look on and look beyond, and there will be an ocean next door.
Social investment has always been an integral part of the Republic Group's DNA. We firmly believe that we have a role to play in supporting and uniting many across boundaries of space and culture in the pursuit of building stronger, more sustainable societies. By forging alliances with NGOs and championing meaningful outreach initiatives, we continue to make an enduring, positive impact on the people and communities we serve. The Power to Make a Difference program is an extension of the bank's commitment to do good by doing better. Doing good by pledging our support to noble causes, and doing better in the service of others.
Every day there is a new event on the horizon that we need to be aware of. There is the increasing incidence of certain diseases among our people, especially with the last few years and the emergence of COVID-19.
We always thought that persons who had severe symptoms or they were hospitalized were the persons who went on to have long COVID. And we're now saying that that's not the case. We can have persons who that are asymptomatic or have very minimal disease, but there's still that persistence. The immune system is essentially not settling down as we would want it to settle down. We are seeing that persons even with a very mild disease are presenting with some of these complaints. Predominantly, number one is fatigue. A lot of persons are now feeling extremely tired. There have been persons who have complained essentially of things like brain fog, feeling very confused, shortness of breath, which continues, chest pain, clots presenting in the legs and in the chest. We know that you can have the cardiopulmonary complaint, which affects the heart and the actual lungs. Then you can have the neurological aspect of it. You can even have the musculoskeletal. Some persons, women especially, are very, very much aware of this, can even experience hair loss, which then triggers anxiety and depression. So it's really understanding the patient as a whole.
I think there was an awakening indeed from COVID, yeah? Because the people who were at high risk of dying from COVID were the people with chronic illnesses, especially those poorly controlled, the diabetics, the hypertensive, the patients with renal disease. You have to have a healthy lifestyle to give you a good immune system to help you to fight illnesses. And if you're healthy, you have better been able to survive COVID.
I hope that you're enjoying our show. And from the Spice Island of Grenada, we head across to the land of many waters, Guyana.
In our setting, a lot of times people wait until they get symptoms, until you feel sick, then you go to a doctor. And they're proud to say, I never been to a doctor before. This is my first time. Well, that's not something to be proud of. Our patients should continuously be seeking preventive care so that you can catch diseases before they start to affect the end organs. Of course, you can go deeper into persons who have specific risk factors and family history, etc., to do other types of screening. But these are the basic things, and in that way, we can stop the 40-year-old from needing dialysis, or the 35-year-old from now needing a stent or bypass surgery. In my experience in Guyana, almost 30 to 35% of the patients who come in with a heart attack are finding out that they have diabetes. What that means is that they would have had it for at least 5, maybe 10 years before, not picked up. And so the damage has already been done that leads them to have a heart attack and come to a cardiac ICU unit.
The most recent study was done by the George Allen Chronic Disease Research Center. It was published in 2015, and it was called the Health of the Nation study. And what they did, they were looking at several things, not just diabetes. They looked at obesity, hypertension, but specifically related to diabetes. In the population of people over 25 years old, as many as 19% of the population had diabetes. So it definitely is a very big public health issue in Barbados, as it is for the Caribbean and indeed for the rest of the world.
I want to encourage the younger people in the Caribbean to be brave and to come out and to get tested for different things that can be affecting your health that you may not be aware of. And it's not something that you want to be made aware of at 50 years old or at 55 years old. Come now. Come when you're fit and you're able to go run 3 miles a day so that you can see about whatever health issue or whatever underlying health issue you may have without having to go into surgical intervention or without having to use medication.
Cardiovascular disease is a leading cause of death in the Caribbean in general. And hypertension, diabetes, CKD all contribute to cardiovascular disease. That's a worldwide problem. We're not screening for a lot of these conditions early, right? Prevention is better than treatment, it's better than cure, right? If you can prevent these illnesses from happening, the burden on our healthcare system would be far less. And we wouldn't be dealing with a lot of the complications arising from not treating diabetes, hypertension, chronic kidney disease.
I'm a bladder cancer survivor, and I can tell you, prevention is better than cure. Make sure that you get your regular medical checkups, regardless of your age now, because people are living longer, so please get your checkups. Do not think that everything is okay. Remember to keep away from chemicals. Be very careful with using your chemicals. I'm now looking at Caribbean Medical TV, and I know you're watching too. Be good. Love you.
At this point in our show, Caribbean Medical TV would like to recognize and thank all healthcare workers for your contribution to our people. We recognize your hard work, your diligent efforts, and most of all, the fact that you have given hope to so many of us. Thank you so much from the bottom of our hearts.
Thank you to our doctors, nurses, medical professionals, and experts for sharing your knowledge and expertise with us here on Caribbean Medical TV. We look forward to continuing to connect with you, our viewers, to share the best advice for you to have the best of health. Be sure to visit our social media platforms so you don't miss an episode.